Hi everyone, this is Dr. Lavraj Sundar here back at Sigil Cornea Clinic in Brampton, Ontario. So today's topic is on ankle pain. So the ankle joint here is made up of the ends of the long bone, and you have in the foot itself, there's actually quite a lot of bones. There's about 26 of them. And the ankle is really important for us biomechanically because it helps to bear our body weight. So it's really important that the ankle functions well. So there are quite a different causes of ankle pain. I'll go through some of them. So the most common causes are either Achilles tendonitis, it could be gout, it could be osteoarthritis. Osteoarthritis can affect any joint, so ankle could be one of them. You can have plantar fasciitis, you can have tarsal tunnel syndrome. It's a specific condition in the ankle joint. Then you can have, of course, any fractures to any of those 26 bones. You can have stress fractures, common in runners or people who kind of pound the ground a lot, so any sports that require that. A lot of marathon runners get that. Then you can also have, I think, pseudo-gout as well, and then there's a few other conditions like ligament tears, of course, common in soccer a lot. So the most important thing to know is if there's any serious swelling, any redness, any heat, or like it's really hot to touch and you can't bear any weight on your ankles, it's really important to get immediate medical attention because of course those are signs of either infection or a fracture. So it's important to get that checked out right away. For most conditions, if they're not fractures or any infections, physical therapy usually does help. Most commonly it's resting for a few days, icing it every day, 3 times a day. Compression, so really compressing the area, so keeping like a bandage tied around, and elevating the legs. So those are usually the first lines of treatment. And then along with that, we would recommend to get acupuncture, get chiropractic, of course, to rehabilitate the ankle joint. Homeopathy, again, because if there's any damaged tissues or tears in the muscle or tendons, it helps to repair that area internally. So those are the treatment options. And then again, if a fracture is suspected, it's important to get an x-ray or CT scan, it depends. And again, it depends on, and the rehabilitation will depend on how severe the ankle injury is. So for the most part, I'll go through ankle exercises that are not due to fracture or anything serious. It could be just a sprain or a simple muscle pull. So the first one is, so I'll just stand up here. The first one is basically for kind of the back of the ankle. So these are going to be heel raises. I prescribe these exercises a lot. So basically you're just going to go on your toes for about 3 seconds and come back down. And you're not going halfway. You actually have to go like right on your toes. So that's the main thing I find that most people don't do properly. So you kind of have to go right up, and then this helps to kind of use all the little tendons in the ankle to help balance yourself. And you want to do about 20 to 30 of these every day. So that helps to kind of strengthen strengthen the area right here. See, that's the first one. And then the other one is, again, I'll go this way, because the ankle has a lot of balance input to the body, so you want to do a lot of balance exercises. So the first one would be a single leg stance. So you're actually just lifting your leg and try to balance yourself and try to stay straight. And you can basically challenge yourself by first trying to hold this for 30 seconds, or start with 15, then 30 seconds, and keep going up to a minute, 2 minutes. And you'll notice that you're going to work a lot of the joint, the muscles that help with stability. That's going to be really working in these exercises. So you can do the other side as well. And you can do 5 on each side and then hold it for, again, start with 15 and then go up and up. So 30 seconds to a minute, 2 minutes, get up to 4 minutes. And if you can do that, then you're pretty good. So that's the second one. The other one is the towel stretch. So this is a really good one. So this one you can do on the floor or on the bed. So basically, you're going to be just how I am right here. And then you're going to take a towel or even like a resistance band. But I'll show with the towel. So you're going to basically put it on the bottom of your feet like that. And then you're going to basically point your toes towards you. Keep your heels on the bed. And then you're going to you're going to pull on the towel. So you get the stretch in the back of the leg. So you can go like this and then go up. I'm actually lifting a little bit, but yeah, so right there. And then you can assist yourself by actually pulling on the towel, and you'll get a good stretch on the back of the legs. And the towel's good because you can actually do a lot of things. You can do like side to side, you can do like try to open up your legs and hold it so that you're working the inside of the legs. So there's actually quite a few things you can do. But the main one is just going up and down like that and holding it and then giving a little bit of resistance. And that's a really good one for ankle injuries. So that's those are the exercises. And if you want more information about specifically balance exercises, really important if you have multiple injuries to the ankle. A lot of patients get ankle sprains and they just don't have one. You're more commonly to get more if you had the first one. We have people who have like 10 ankle injuries, so a lot of their balance is off and we have to work a lot on stability. So it's really important to get the proper exercises, so it's important to consult the appropriate chiropractor or doctor to help you with that. So that's pretty much it for today's segment. Last thing is the acupressure points. So there's 3 of them. I'll show you them right now. So the first one is you'll see the bone in the inside of the ankle joint. So again, just like in the hand, you're just gonna press on it. Again, 15 seconds, 2 to 3 times a day. So that's right on the inside of the bone. That's the first one. The second one is here, on the top of the ankle here. Again, you're gonna press 15 seconds and hold it, and then you can do that one. And then the last one is on the outside of the ankle. So outside of the bone, same thing, I'm gonna press and hold for 15 seconds. So these are acupressure points you can do as well at home. So that concludes our segment for ankle pain, and then I'll join you guys again next week for another topic. Thanks.